Okay, yeah, go for it.
We're good.
Okay, thanks, Angie. All right, so quick Zoom etiquette. Stay on mute for the most part. Coming off mute is a cue for us to really pay attention, and we'll know that you're ready to talk a little bit. We're going to have times where we're going to ask everybody to come off mute and talk together. It can be kind of confusing, but it's also really good to do. If we hear somebody that's off mute and we hear some background noise, we may just put you on mute if we need to. We encourage people to keep the video on if possible. We love to see your humanity, your children, your dogs, your cats, your bookshelves. All that stuff is really a nice way to actually get to know who is here on the Zoom call, since we can't quite be in the physical room together. And then we're going to really encourage you to use the chat function pretty liberally. And Charlene will look, and Fiona, I'll have you also, if you could just make sure you've got the chat open and are watching as well, that'd be helpful. So here's what you can expect. Today's probably going to be the most, what I would say, didactic in terms of the information that we are going to be providing. We're going to be providing lots of information over this session, the session on November 2nd, and then there's a third session. I can't quite remember the day, but it's in the announcement. These will be as interactive as possible, particularly as we move into sessions 2 and 3. That we're actually, Charlene and I are going to give you homework. And we're going to give you homework with the intent of turning that around and then actually us using it to design work for the next couple of sessions. So that'll be really important, so that we're going to try to tailor it to what you all are generating and what we want to also try to do in the context of the Kaleidoscope Project, which focuses on places and spaces for children. The other thing that will be important is that we're also going to make available resources that we've been recording and putting on our Partners for Impact website. We make those available to you all, and the training is going to be as meaningful as you make it, right? So that's just the way oftentimes trainings are, is the more you put into it, the more you're going to get out of it. And the flip side is the more you use Charlene and I in this work over the course of the next 2, 4, 6 weeks or so, the more you'll also get out of the training. Charlene, is there anything else you can expect? We should expect?
Yeah, just to reiterate, we want this to be as useful for you as we can make it. So if you have specific questions, or you want us to, you want to follow up with us later to explain something, or you want us to go in a certain direction, please let us know, because we want you to come away with something that's really useful that you're going to be able to use. And we can only do that if you give us feedback.
Great. If you have any questions about this kind of stuff, throw it in the chat and we'll get to it. Here's some other different kind of expectations that we want you to begin to think about. We're randomly gonna, yeah, it was kind of random. We asked actually Melissa to pair you all up. We're gonna put you with an evaluation buddy. And the role of that evaluation buddy will become clear as the session as we move through the session today. And it'll be really important to connect with that evaluation buddy based on the homework that we're going to give you, and just to talk to them and share and critique each other's work before you come to the next session. We also really believe, so many of you have been participating in the Kaleidoscope Project as some of their funded projects, but we want to begin to really build a community of practice around this work that is associated with the social and emotional well-being of children, and the way we use place and space, and not only about the issue itself, but as we design and implement and evaluate these ideas that we are implementing across the community, I feel so lucky to have heard about so many of the projects. Before COVID, we actually did some site visits of those first projects, and seeing some of those projects in action is pretty amazing. And we know that if you all can interact and talk with each other and learn from each other from this community of practice, it's going to benefit the whole system.
I would say there's a couple, but just stand that there's a couple people on who may not be Kaleidoscope funded projects. There's just a couple of you, but almost everybody is involved in early childhood learning and in early childhood development. And so you will absolutely add to the conversation, and we can share with you, if you do not already know, the resources from the Kaleidoscope Project, because if you don't know about them, you should.
Great. And then the last piece that we are really paying attention to is this notion of equity. And hopefully some of you had the opportunity to take the session with Sterling and Kathleen a couple of weeks ago. And we are really trying to be very deliberate in how we look at evaluation and program design in service of equity, in service of how we use tools that we know and are part of our evaluation toolkit, but with that lens of equity, particularly as it relates to racial equity. Charlene, you want to add to that?
Yeah, so if we know quite a few of you were on that training, or you may have had other trainings coming into this, and we really encourage you to think with your equity lens and what you understand, and ask questions. Stan and I are very much learning this now as well. We're working with Kathleen and Sterling very closely and learning a huge amount from them. And if we can't answer the questions, we will, we may circle back with Kathleen and Sterling and check in with them and get you answers. So we may not be able to answer on the spot, but we really want to make sure that that we are, as Stan says, we're really working in the service of equity, and also that maybe we're helping you take some of the concepts that you may have learned in equity training and operationalize them and make them a little bit more concrete about how do you actually apply what you've learned in those trainings.
And Charlene, I don't think we have a slide on this, but this session, it's going to be a lot of talk. It's going to be introducing and working with the evaluation concepts. The second session begins to bridge that conversation between evaluation and equity. And then the third session will really move us into the equity work and begin for this group to kind of function as that community of practice in talking about how do we apply what we know about evaluation and design, equity, in really bringing that to the projects that we're looking at with regard to places and spaces for children, and how those places and spaces support early child mental health. We have created on our website a secure site for you all, and you can go to our website, and in the resources section, there's a whole little box for JRE training, and the password is Kscope 2020. We'll have the video from today, we'll have the slides from today, we'll have the homework assignments, and we'll have the templates that you need to work with as we kind of move forward. It'll be kind of a resource space for you on the web.
Also on that page, I was going to say, we have a syllabus up on that page, so you can kind of see what the flow of the 3 weeks is going to be. It gives you the dates and the times and what the homework is, so that you, if you forget, or you don't have to take copious notes, you can go and that'll be there for you to look at.
So a pause there, because that's kind of the intro, expectations, here's where we're headed bit of the conversation. Any questions, comments, anything in the chat?
No, just Fiona reminds us that the password is case sensitive, so be sure to capitalize the K, and we can get that website and password out to you by email if that's so
We'll do
that
that
you
tomorrow.
have it there. Okay, got that, Melissa. Yeah. Yeah. Any other questions? Okay. And yes, if you missed the part of the equity training, or you we weren't able to attend that, no worries. We will be building on it, but you won't be left behind. We'll try to make sure that we really start from the ground when we're talking about the equity pieces, because as we talked about, we're still learning about it too. So no worries if you missed the equity training or weren't able to get to all of it. Any other questions?
Thank you.
Yeah, and yes, and we can also share the materials and slides. Yeah, Kathleen, thank you, Kathleen. Share the materials and slides that they provided, that Kathleen and Sterling provided during that training, so that you at least maybe have a little bit of reference if we bring up some things. We will try not to mention, we'll try not to go too deeply into things without an explanation for those who weren't at the training. I mean, to be perfectly honest, I don't think I could even begin to fill Kathleen and Sterling's shoes. So you'll really be getting this from Charlene and Stan's interpretation of it.
Yeah, and that's kind of an important element here. Charlene and I are both evaluators, and we're gonna be very cognizant of trying to really couch this in terms of program design and program evaluation. But there's a lot of information that's getting ready to come up, and don't expect you to know it all, right? It's just the beginning of thinking about how to really look at your programs and measure their impact in the community that you're having. Yeah. Seems
Yeah,
like
kind of.
Go.
Yeah, I think going to the equity back, one of the norms, is that, sorry, I just realized I missed my daughter's piano lesson that was starting 3 minutes ago. Sorry. This is the humanity part of us, right? So the norm is to lean into the discomfort. Isn't that right, Kathleen and Sterling, right? You may not get all the answers this time, you may not understand everything, and it really is, let's get as much as you can, and then come back to us with your questions, and we'll try to help and work further. And this is not the be all and end all, and we don't expect that by the end of this, you're going to have all the answers. Okay, I'm going to pop off for a moment, Stan, but I will be back.
Okay. All right. So today, what we're going to cover, pretty foundational, basically foundational definitions of what evaluation is and why we would evaluate our programs. And then we're going to be introducing you to a couple of kind of key tools for evaluation, and that is the concept of a theory of change and a logic model. So that's what's going to happen today. So in the chat box, tell us what comes to mind when you think of evaluation. What do you think about when it comes to evaluation? Feedback, right? Learning, assessing how effective we are. Impact of our program. Is it working? Absolutely. Effectiveness, fit for the population, improving the program, data, how our program is doing. Right. It's all about that, right? It's all about all those things that you're popping in the chat. Know if the program is effective, effectiveness in improving areas. Yeah, perfect. So when we start thinking about evaluation from the standpoint of, let's see, why is my cursor? There it is. You know, there's some official definitions, right? And one of the definitions that we have, you know, one of the organizations that has done so much work around evaluation is the Center for Disease Control. Charlene, I'll do this slide and then turn this section back over to you. The Center for Disease Control has done a lot in terms of program evaluation, health programs that they do. And it's a system of collecting, analyzing, and using data to examine the effectiveness and efficiency of a program, and as importantly, to contribute to continuous program improvement, right? So that was captured in all the words that you all were putting in the chat box. It's this, you know, effectiveness, efficiency, and more importantly, contributing to the continuous program improvement. The Canadian Evaluation Society, evaluation is a systematic assessment of the design, implementation, or results of an initiative with the purposes of learning or decision making, right? So sometimes we use evaluations not only for, we learn about, we create learnings from the evaluation, but ultimately we want to make decisions. Sometimes those are decisions about our program. Sometimes those can be decisions at the organizational level. And quite frankly, sometimes evaluation is used at the systems level when we're evaluating, looking at different public policies. Charlene, it's going to turn it over to you, and this is kind of your section stuff.
Okay. So you want to go ahead to the next? So actually on this, oh,
yeah.
Okay. On the other thing that just to pull out of this is continuous program improvement. And the purposes of learning and decision making. So really making sure that we all understand that so many times we think of about evaluation as just that at the very end of a program, you evaluate it, was it effective? What were the outcomes? What did we achieve? But that evaluation, good evaluation should be ongoing monitoring throughout what you're doing, so that you don't get to the end of 3 years only to find that if you had changed something 2.5 years ago, you would have had a much better outcome. Okay, we'll go to the next. Yeah. So in short, there's a couple of shorter ways to think about it. What were you intending to do? That's a really good thing to know in the beginning. What were you actually intending to do? And we're going to talk about that a little bit. How did you do it? You know, so in implementing it, was there fidelity to the program that you were implementing, or as you plan to do it? What happened as a result of what you did? And is there a way that you can improve so that you could achieve better outcomes or more, or better outcomes, for example, more equitable outcomes? Maybe it worked really well for one part of your target audience, but not for others. So how can you improve it? Okay. In other words, what, so what, now what? I think Angie might have said this earlier in our earlier meeting today. What did you do? So what? What difference did it make? Okay, now what decisions do we make from there? Okay. So what are some reasons? We've talked a little bit about it, but when you think about evaluation, what are some reasons that you want to evaluate your programs, or you are the reasons that you are evaluating your program, whether you want to or not? So give us some some ideas in the chat.
And I'd encourage you to be specific to your program. Like, why would you evaluate your links program, or why would you evaluate your
Parks and Rec program? Right?
Parks and Recs program? Be specific
Right.
about your what you're thinking about here.
Yeah, how are you thinking about evaluation in your work already? Okay, to determine sustainability, good. All right. Impact for future funding, yes, that's a familiar answer. See if we should offer it again, great. Right, right. If you want to keep something going, is it working? Is it the thing that you should be doing? Right.
Boom, boom, boom. Here they come, Charlene.
Right. It's hard to read them that fast. But right, how effective are your tools and what you're using? So not just, that's great one, Kathleen, not just, you know, what's the effect of the overall program, but how about the different pieces that you're using, right? Add to the strategic and plan and development and growth plan. Great. Are we overlooking needs that exist? Right. Are you? Yeah, that's really going back to why did you start the program, and is it meeting the needs? Are there additional needs? Yeah, great. Yeah. How to continue scaling, right? And scaling up into a larger project, right? And be sure it's working for the target population, right? What impact does it have on children's lives? That's, yeah. That's your long-term impact, right? What is it? What is happening? Yeah. Going from in-person to Zoom lessons, that's from the community music school, right? Of how do you know what's going to work, right? Opportunities for growth, quality of life survey to our program design to get client-specific feedback. Yeah, great. Okay. Those are great. And if you think of more, put them in the chat, because we really want you to be thinking and sharing as we go. So if more things come up, share them with us. So some of the reasons that we often hear and we really think about why people are evaluating, and it's kind of what I was saying about sometimes you don't really want to evaluate, but somebody's making you evaluate. And often that's because your grantor or your funder or the state or the foundation, whoever is giving you the money, wants you to do an evaluation, wants you to provide them information. Or because you're applying for a grant. So the first one might be they've given you money, they want to know what you've done with it. The second one is you're applying for money and they want data to know whether they should fund you. You know, what do you have to show that this is an effective program and who you're reaching. Improve implementation of a program. A lot of you talked about that, and whether it's worth continuing and whether it's achieving its intended outcomes. So y'all hit a lot on that. But we really want to kind of acknowledge that sometimes you are required to do evaluations and give numbers for grant funders that are very difficult, and it almost gives evaluation a bad name, and people kind of dread it. And so what we hope is that we'll help you set things up so that it's not a dreadful ask, and that you really can meet what the grantor wants and what you need for your grant application, but also it's really useful for what you are doing in your program. So good evaluation can be really useful and not the dreaded task of the grant application. Okay.
Yeah, it's also, yeah, I was just thinking about the whole, as you were talking, Charlene, about the difference oftentimes between particularly philanthropy and foundations and then government. And so many different funders may have different ways of approaching evaluation and how they measure the success of the agencies that they fund. So I just think it's important to think about the funder, but more importantly it's for you to think about your program and your organization. It's a tool for you, so that ultimately, even the ultimately, if you know the program and even are looking at, okay, does the funder require this kind of measurement, you can use evaluation and the process to actually improve the program to get the kind of reporting that you need for whichever type of funder. So I think I just wanted to say that for some reason. Next.
Yeah, and I would say, that both Stan and I have worked with nonprofits for many years that have had foundation funding and have had state funding and federal funding. And so we are well aware of what those reporting requirements can be, and that sometimes they can be really burdensome. Sometimes they can make it seem like there's no connection between what the questions they're asking you and what you're actually doing, or it's almost impossible to connect the two. And so what we hope is that we'll be able to help you develop an evaluation plan for yourself that kind of meets a lot of those needs. But our hearts are with you if you are struggling with like federal reporting, as we understand. Okay, this is quickly what I was saying before. There's kind of two different kinds of evaluation. The first one being the formative evaluation, and that's what's happening while you're running your program. How is it going? And Stan's metaphor was when the cook tastes the soup while cooking. So all along as you're going, you're making sure that what you're putting in is actually going to come out to be something that people are going to want to eat and is going to be what you want it to be.
Well, see, and we can take this, it's great, right? Because it's like you have a recipe, right? So what's our curriculum? So here's our recipe. And we start putting the stuff in the pot. So we're following the recipe. And then what do we want to do? We want to taste the soup. We want to see if the curriculum is working, kind of stuff. So I like to play with metaphors like this.
Right. Yes, you'll see when you watch the videos that it's also about making cookies. So
yes.
Yeah. So then the other kind of evaluation is the summative evaluation, and that's okay. Now you've made your whole soup, and you provide it to your guests. You you put it in front of your guests, and they taste it. What do you think? What's the outcome of the work that you put in? Any other thoughts on that, Stan?
No, that one's pretty straightforward. Do your guests like it or not?
Right. Yeah. So that's really, did it work? When you followed the recipe and you did all those things, did it work? Did it not work? Okay. Next. Okay. So we're back to the chat box. And so what we want to know, going a little bit further on our soup metaphor, on a soup scale of I can open a can to I can make a gourmet soup from scratch, what is your level of experience and comfort actually with theories of change and logic models? I'm sorry, I feel like I was thinking that this was about evaluation, but with evaluation and specifically with the words theory of change and logic models, is this something you have experience with, or something that's new to you? If it's something completely new to you, you can put in, I can open a can of soup and warm it up. Or if you've got lots of experience in this, you're very comfortable, then you can make a gourmet soup from scratch. And if you're somewhere in between, you can tell us what that means on a making soup scale. And yes, we're gonna, good, can make it. Thanks, Kathleen. Yeah. There you go. Yeah.
Making soup with help.
Yeah. Okay, Gwen, right? Great. Yeah, and this is just so we know, who our audience is here. Run some verbs. Yeah, great. Excellent. Yeah.
Okay, good, Richie.
Great. Richetta. Yeah,
Richetta.
Great. Okay. Excellent. Okay. Both. You have both experiences depending on what you're trying to do. Okay. Yeah, right. Yes. And yes. So Michael talks about the long view, and that is, we'll talk about kind of short term, we'll talk about outputs, outcomes, short-term outcomes, long-term outcomes, right? We totally, and that's part of the, I think, the frustration sometimes when you're dealing with reports for funding agencies, is they expect you to have that long-term outcome measured, and as the program person implementer, you recognize that you're not nobody's in a position to measure those long-term outcomes, especially if the funding's a year, right? So we'll talk about that as we go.
This is great.
Yeah, soup from scratch. This is great. Yeah,
we've got good.
Yeah, good. So it looks
Good
like we've
soup
got
makers.
a nice range of folks who are taking the can out of the cabinet and hopefully not hurting yourself as you open it and put it on the stove. Nobody put that, like that they would be afraid to do that. So that's good. To those who were coming to your house for dinner someday when it's safe again, for the soup, the gourmet soup from scratch. Yeah. Yeah. Or a nice hearty edible soup that may not be gourmet is good too. Okay, good. You want to go on, Stan?
Yep.
Okay, so today we're gonna introduce the theory of change pretty quickly, actually, but we'll be looping back to it, and we'll mention it a couple times today and in the next couple sessions, particularly in the third session. But and then we'll go in our second half, we'll go a lot more deeply into the logic model, and that's what we're really going to spend the rest of the day on. But let's go to theory of change. Okay. Before I go, actually, are there any questions up to this point?
Good.
You can, if you have a question, you can put in the chat so we can see it. There's so many people on the screen, it's hard to see if you're unmuting yourselves. Everybody's with us so far. Everybody's knows what we're doing. How do you define program? That's a good question. Good.
Yeah, so Kathleen, I really define a program as kind of a combination of the services that you put together in order to achieve the change you want to see. It's pretty straightforward it's the things that you do in order to get the outcome that you want. And those things can be curriculum, it can be different types of interventions, different conversations, different resources. Resources in and of themselves can also be part of a program.
And we'll talk a little bit more when we get to the logic model, because you may have what is true for most agencies is that you probably have multiple programs running with the intention of having the same, they're all going towards the same outcomes and impact. But you have, you might have a program that's running for your birth to 5 children and their families, and then another program that's running for the elementary school kids, and then another one that's running for middle and high school. And the more that you can pull those out, and we'll see on the logic model, so that you can look at all of those separately, so that you can think about what the outputs and the outcomes for those individual programs are, and then how they feed into the impact for your agency. But really, I would say how you define a program, I think that all agencies define programs differently. And what is important is that that you understand what the parameters are and what the activities and the outcomes of that program are that you are defining. Okay, good. Okay, so here we are at theory of change. And basically that means, why do you do what you do? And we're really talking at a pretty high level of why are you doing the work that you're doing, kind of not on a personal level, but how does your organization decide that this work would have that outcome? And you know that. Okay, so why do you do what you do? Okay, go to the next slide. Okay, so for example, a theory of change would be children with caregivers and families who have more skills in parenting and a strong support system have better emotional health and well-being. Okay, so it's a very broad concept of what we have. It might be, we don't use the word evidence-based anymore, but there may be science behind it. And that if you do this, then if you do A, then B will happen. You hope, right? Stan, you want to add to that?
Yeah. So the way I kind of break this sentence up, we think about the children with caregivers and families who have skills. That's a particular type of outcome, but and a strong support system is a outcome, and that leads to yet another outcome, emotional health and well-being, right? So you've got multiple elements that lead to a child's emotional health and well-being right there, right? It's caregivers with skills and caregivers with a strong system that lead to emotional health. So I kind of think of it as all the outcomes that lead to other additional outcomes that have a greater impact in the community.
Okay, and I'm just going to go. So what is the actually? Can you go back for a minute? Because we had a question about what, because I said that we don't use the term evidence-based, and so the question was why not? And that's around equity, because a lot of what has been found is that the evidence is often based on research that's done by white researchers with white subjects or with limited subjects, and the evidence doesn't always translate to all people, all groups. And so it's held out as the standard, evidence-based is the standard, but there's oftentimes when it's been found that evidence, those programs that are evidence-based are great for maybe the majority culture or the majority, but because of the way the research was designed, it wasn't looking at the results for everybody, and there may be actual harm being done to other groups. So we're still actually trying to figure out what other ways to speak about that are, but it's a very interesting discussion around the science of evidence-based programs. I hope Kathleen and Sterling that give me a thumbs up if I got that right. Good, yeah. So that's a whole nother discussion, and we will actually talk about this as we talk about measuring your outcomes. We'll go into more of that because it's all part of the equity discussion. So I hope that answered that question. Okay, so now back to theory of change. And so, but it goes to also of making sure, it's a good reminder that when you're thinking of your theory of change, are you thinking about the impact of your program and how it's going to have an impact on everyone who you're serving? And it may not serve everybody the same way. and making sure that you are thinking about that as you're designing, as you're thinking about your theory of change and designing your program and thinking about your impact. Okay, so then the next one was what is the impact?
I just gave that away, sorry.
It's okay, we can go on. Or do you want to speak to that?
I kind of did already.
Okay, good.
Sorry.
No, it's okay. We're going. Okay, right. So here, this is very, like, Zoom is hilarious and all the different things that you have to do to see everything. Okay, so the impact. So here we have the theory of change, and what we want for the impact is that children have better emotional health and well-being. That's why we're doing this. And what we think will get us there is more skills and for parents and a stronger support system. Okay. So then as we're thinking about the theory of change, what is the outcome that we need? The question is what is needed to achieve that impact? The impact of, I think I just said this, but I'll just reiterate it. The outcome we want is children with better emotional health and well-being. And what we need to do to get that to that impact is we need caregivers and families to have better parenting skills and support systems, right? So we need to strengthen parenting skills and build support systems. So that's the outcome. The outcome is caregivers and families with parenting skills and strong support systems. Okay. Yes, I'm curious, since I feel like we had a bit of a hash of that, but are there questions about impact and outcome, which is what we just covered really, and theory of change? Hopefully it'll also come together as we go into the logic model if it's a little hazy now. Can you think of, is it getting you thinking about your own program? Do you know what your theory of change is? Do you know what the impact is? Do you know what your outcomes are? I can't see anybody. Thumbs up, everybody. You're with us? Okay. Okay. Questions, thoughts? Okay. Good. Okay. Stan?
I think we're at a break time.
Perfect. Yeah.
So what we're gonna do is it's 3:03 and we're gonna break until about 10 minutes after 3. And when you come back, we are gonna have a link in the chat box, and we want you to begin to think about and connect with your evaluation buddy. And we'll talk a little bit about your evaluation buddy and what that means and what that is when we come back at 3:10. So shut your screen off, put your mute button on, go get that afternoon cup of coffee, and we'll talk to you in a minute.
Okay, now we're recording. We're good. Okay. Okay. So anyway, so Stan and I love logic models. We could talk about this all day. And it sounds sophisticated. It's really a graphical way to think about your programs, from the things that you put into it to the impact that you want to have. We left out impact off of this, but to the right of your outcomes is your impact. But your individual programs are going to go from what you put in, what you do, what comes out of it, and then what is the what changed because of what you did. Okay. Next. Okay. So we're going to start with talking. So the way that I think both Stan and I think about this is rather than start on the left, reading left to right in a logic model, we really, as you have already seen, we really start on the right with what the impact is and then what the outcomes are. And we're kind of going right to left and kind of that funnel of the big picture. And then we're going to narrow it down into more specifics. So let's start with outcomes. First, just tell us in the chat box, who do you serve? And be very specific. So we have a couple of examples here. You know, it could be young adults ages 18 to 24 aged out of foster care and find themselves homeless, or food insecure homebound seniors, or families of children 0 to 5. Right, great. Child care providers, right, who work with children ages 0 to 5 with disabilities and behavioral concerns. That's great. That's so specific. That's wonderful. Yeah, 18 to 99, and youth females 9 to 17. Wow. Right. Families with children 0 to 18. Great. Okay. Adults running programs and giving away money. Yeah, that's good. Parents and children experiencing homelessness. Yeah. Child care providers 0 to 5. We assume that means that the providers, the children are 0 to 5 and not the providers. Children ages birth to 5, right? People are food insecure 0 to 18. Interesting. Ainsley, you're at Parks and Rec, right, Ainsley? I can't see you, but.
Yes. I
yeah.
just threw it in there as an example of some.
Oh, okay, okay. Okay, thanks. Thanks for clarifying.
We have a wide range. So.
Right. Okay. Got it. Yeah. All ages, right? Okay. Yeah. But can you be more specific, Jemima? All ages, what do they come to you for? What do they need you for? Or what are you providing to them? Families with children in the household, at least one minor child. Great. Okay. Okay. So that's good to really think about who you're, who are the outcomes that we're thinking about, who are they targeted to? Now, the next question is, what change do you want to see for that target population? Is that a chat box too, Stan?
Yeah.
Yeah. So now you've told us who you serve. What do you want to see for them? What's the change that you hope? What's the outcome, the impact that you want to have on the people you serve? And you can put that in the chat box too. Share that with us.
Right. So I always like to think of what change for what group of people. And we saw, and if we use our example, it was parents, caregivers and parents increase their skills, right? We want improved skills for caregivers, greater support system for caregivers.
Yeah, great. Yeah, great. More participation for youth, females in recreation sports. Young children with disabilities are able to fully participate in childcare and preschools with their typically developing peers. Great. Children are prepared for kindergarten and a successful school experience. Emotionally healthy lives, children living emotionally healthy lives. Great. Secure emotional relationships between caregivers and their children and teachers and their children. Great. Yeah, alcohol and drug prevention for individuals and parents. Great. Great. Prevention of alcohol and drug use for all ages. Good. Increased informal support for home. Okay. Nonprofits would have the skill, will, and confidence to lead for racial equity and act in anti-racist ways for the organization for whom they serve. Is that all you do, Sterling? Come on. I'm just kidding. That was totally flippant of me, but all of you, it's like basically, we want to change the world, right? Access to healthier food for youth and families, great. Yeah. Okay, provide better resources. Excellent. Okay. Okay. Good. You can keep writing. I'm loving reading all of the things that y'all do and learning about it. And really, this is also starting up the community of practice, right? And building this community of practice, because everybody else on here is learning about what you do and who you serve and how you go about doing it, so that as we develop this community of practice, you can all make connections among each other as well, right? And how you can connect outside of these trainings. Okay, so we've talked about outcomes in our logic model, right? That's what the change, what change for what people, right? Great. Okay, and so then we're going to kind of do a little iterative piece, which is we're going to go to activities next, right? Okay, so actually we go back, please. Okay, so we have the outcomes. Now we're going to ask, what do we have to do to get those outcomes? And that's really where we go to the activities, okay? And to me, we go to the activities next, and then we'll go to the inputs and the outputs at the same time, because they're really related. So the next question we're going to ask, we asked what change for what people do we want to see? Now, what do we have to do to get there? Okay, so now we go to the next slide. And so what will you do to get what is needed? Okay, so here in our example that we're using, children with caregivers and families, whoop. Oh, okay. Children with caregivers and families have more skills in parenting, strong support system, so that children will have better emotional health and well-being. What will we do to get what we need, right? We need the parents and the caregivers and families to have more skills in parenting and the stronger support system. And so what we're going to do is we're going to train caregivers and families and provide a strong support system. That's what our activity is going to be. That's what our agency has decided it's going to do in order to achieve this outcome, or in this part of our program. Okay. Okay. And so what we need to do is we need to train caregivers and provide the strong support system. That's our activity in our logic model. Now we ask, what do we need to do that? And how much will we do or can we do? So this is where, for me, the inputs and the outputs really have to go together, because I may say, I want to train, I want my output to be that I'm going to train 100 families in parenting skills and provide a strong support system for them. But the reality may be that I only have the funding and the staff to train 50 families or 40 families. And so my outputs would be the 40 families, and my inputs would be what I need to train those families. Let's go to the next slide, and hopefully that will make a little more sense. I don't remember what's on the next slide. Right. No. That's not okay. This is what happens when you understand things and then you try to explain them, and you realize that what you are thinking may or may not come out. So does that make sense of where we are? Actually, this is good. Let's do the last one. That's good. This is good. Okay. So where we are is we started with outcomes. And here's an example from our logic model, a sample logic model, right? Our outcomes are they have better school skills to connect with their children. They feel less alone. they have more support system, right? They feel they have someone to call. It also means they have less stress, and then then children will experience less stress. So that was our step one, our outcomes. Step two, what do we need to do to achieve the outcome is our activity, right? And so we went to our activity, which we said was the training. And then step three and step four, what do we need to do the activities and how much can we do given that? Let me see. Oh, good. So let's go to our next slide, which actually fills in these things. Okay, good. So here we have on the far right, we have our outcomes. And then we get really specific here on our activities. What do we actually want to do? And how often are we going to do it? And what's it going to look like? And then based on those activities, we can figure out what do we need in order to do those activities and what will come out of it because of those activities, right? And one of the things that I'll point out is making sure that your inputs are really realistic about not just money and materials and physical things, but also the staff time that any project, any activity that you do is going to require. I think that's an area I would say where I've seen in my own experience working in nonprofits that agencies don't always take into account how much staff time activities are going to require, especially if it's something like somebody's going to be on call to answer questions, or somebody's going to follow up after a program, or somebody's going to be available after a program to support the participants, right? That takes time, that kind of stuff takes time. And so that needs to be put in your inputs. You can also see that the outputs, as opposed to the outcomes, are very specific, right? So that we really know what we're getting for our activities and our inputs. Stan, do you have thoughts on listening to what I said? What did I leave out? Or
yeah, I think you covered most of it. And the big issue is the whole difference between outputs and outcomes. And I always think of outputs generally as counts, right? Because it will, so if you're a case manager and you're working with homeless families and you're one case manager and you're thinking about, and your supervisor's thinking about how many families with children can you work with, you want to be able to know kind of, well, what does case management mean? It means spending X number of hours with them. That's your activity, right? And then ultimately that will give you a good ratio of one case manager to no more than 15 clients at a time, right? So there's ways in which you can begin to think about your program in those kinds of terms, depending on what your level of activities are. And one of the things that's going to be important is that this doesn't make sense until you start putting pen to paper. Okay. So we're going to have you do, your homework is to do a logic model for your program. And it's going to be important to play with it, to think about, okay, what's the change I want to have? Okay, what am I going to do? And hopefully, I mean, ideally, you've maybe done this already with a program, but really challenge yourselves a little bit to really think about this, because one of the things that we will do in the next session is begin to think about how do we overlay this concept of equity, and how do we use this tool in service of equity with regard to the outcomes or the change that we want to see. So we're gonna have you really think about this and use this tool as we kind of move through. So that's what I want to say. It really doesn't make sense until you start playing with it on your own.
I'll also add that we have here just outcomes as though there's only one type of outcome, but I think on the template, and definitely in as you're working through, you might have shorter term outcomes and longer term outcomes, or long-term outcomes. And so there may be some stages that are past the outputs of just the counts of who went through the training, or who you immediately interacted with, to the next stage, which is kind of an immediate outcome, or a shorter term outcome that you can see in a short term, and then that's ultimately leading to a longer term outcome that you may not be able to measure in a couple of years. It might be a longer term outcome than you can measure, but you may have some outcomes that are shorter term outcomes that you could measure in your 3-year or your 5-year program. And they're not just the outputs of how many people went through your program, but actually the changes that you're seeing. One of my thoughts as I was presenting was also thinking about y'all's experience and what we want to know from you as we go through the next 2 sessions and you do your homework. What are the other words or terms that you're hearing from, for example, from foundations or government funders about how you're supposed to report your outputs and your outcomes? What are they asking for, and what are the terms that they're using? And we want to make sure that when you come away from this, you can take what we're talking about and translate it into those terms that your funder or whoever you're evaluating for, even if it's for yourself or for your board, that we can make the connection if you're not seeing it. Okay. Because I will say, not everybody uses these terms, and especially, I've seen some new grant proposal formats where they ask things in a different way. And sometimes it's, you get your head around one way of doing it, and then you get a new grant, a new funder, a new grant proposal form, and it's asking you for something that feels like it's very different. But to bring that to us, and we'll see how we can help you translate what we're doing into that format.
And it literally is a translation, because everything you need is on this logic model, right? If you do these elements, you will have everything you need to move forward. It's just where in the application does it fit?
Right. Yes, exactly. So as you're right, if you do this, if you find this and really get good at this tool, then when you put everything out here, then as you need to create your budget, or describe your activities, even describe your activities in a brochure, or report to your board, or develop your elevator pitch about why you're doing what you do. That's in your impact, right? And your elevator pitch is, why we're here, and what the change that we want to see, and this is how we do it, right? There's your brochure right there. And so it can be a tool for all kinds of things. And then as we get into evaluation, it's also reminding us this is what we said we would do and why, and what we wanted to change. And so it gives us some grounding for how we're gonna collect data and measure the change. And we're gonna know, we're actually gonna have explicitly said, this is what we wanted to do and why. And it'll also pull out some of the things, particularly in input, the input column around, and the activities column actually, around are we doing these things in service of equity? If we expect an outcome that is an equitable outcome, are we sure that we're providing all the inputs? Are we sure that the people that we're putting into the system, the rules that we're putting on our folks who we're serving, the resources that we're putting in, and the stories is the fourth one, right? The things that we're believing, are they all in the service of equity? Are they all racially equitable, so that we're going to get the outcomes that we want? This will make more sense when we talk more about equity, but the point that we really want is, the more detailed and the more information you put on here, it's like a roadmap. It can be a roadmap for your programming and for your evaluation. Okay. So Stan talked about the homework. It's on the next slide here. Oh, didn't we have a homework slide? No. Oh, okay.
We do, but we do this first.
Yes, sorry. It's because my printout goes that way instead of that way. It's also difficult. Okay, so in the chat box, tell us what makes sense, what needs clarifying. Can you translate your program into a logic model framework? Do you understand? Is it making sense? So tell us good and bad. Tell us what you understand. Tell us what, it doesn't, you don't need to write long sentences. You can just tell us, give us a couple of points about what's sticking with you as you come away from here, from what you've heard today. What do you want more information about in the chat box? For number 3, can you translate your program into a logic model? Do you think that you can see how to, or do you already have a logic model for your program? Okay, prepared by your funder, right? Okay. Beth, can you tell us again, what's your program? Who are you with?
Right. It's Circle of Parents. It's a support group under Project Catch at the Salvation Army, and we're funded by Department of Health and Human Services Children Trust Fund of North Carolina.
Great. Okay, thanks. Yeah, I understand. Okay, Sezia says, yeah, understand. Okay, are there questions? Things that you want more information about? I feel like I spoke at lightning speed and gave you all a lot of information. And
well, this is the way this is the challenge of logic models, is it really does require playing with the physical piece of paper or the computer. It just requires that time.
Right.
So there's an element of experiential learning here.
Yeah, great. Yeah, having a clear impact is really important, right? Great. Create. Yeah. Having one, right? So you might have one that came from your funder about how you're supposed to do it, but you can also look at, okay, how does this work in our agency? How is this working for for the realities of our program and our community, right? On a partnership by partnership basis. Yep, absolutely, Kathleen. Yeah. So as you're working with different groups, it's really good to work together around what are you trying to achieve. we did Stan and I did a training on this a couple weeks ago with another group and talked about using it with your board of directors, right? So for the board of directors, not necessarily creating a program that would serve clients, but what does the board of directors itself want to achieve? What's their impact? What are their outcomes? What are the activities that they want to do? Great. Thanks, Marilyn. Yeah. Yeah. Others, are there questions? Are there things was there things that were new to you today? Tell us what was new that you didn't know before. Long and short technical changes. Yeah. Right. Yeah. We're such good trainers, Stan.
Yeah, well,
It's crystal
can't-
clear.
I've lost all semblance of a chat. I cannot find it anywhere on my
No,
screen,
it's
so-
very hard to find the chat when you're sharing
So-
your screen. Yeah. Great. I've made a pretty good soup. Good, excellent. So yeah, so you may actually be able to do more than open the can. You hadn't thought about it. Right. Right. Great. Yeah.
Stan and
Yeah.
Charlene, this is Sterling. I have
Yeah.
one question.
Absolutely.
So, and I think Stan, you were explaining this when you were going through the outcomes, the outputs and outcomes distinction. And I'm probably about to get this wrong, but I think you were saying that the outputs are kind of associated with numbers like 10 people trained or so on and so
Right.
forth. Are there any situations that are, so when you're thinking about distinguishing, maybe you answered this, distinguishing the outputs from the outcomes, is the outcomes kind of where, if you're talking about like skill building, right? Or like building, is that where kind of for lack of a better term, where numbers are not really the measure necessarily, but you're trying to kind of build, like, how does that all work in?
Right. So I think of outputs as the number of things that are completed, but the outcome is the change in the folks that you want to see. So you can say, like, you can do a, for example, a pre-test when somebody comes in and looks at parenting skills. And then you can do a post-test after your curriculum, and you can measure that change, right? So that's a way to talk about it, but it's that you can, and you can measure change. It's a little more difficult than the counts, right? And it takes a little bit of time and elements to do that. And depending on your resources, you may measure it in different ways. There are numbers there that you can draw on. The one thing that I will say is that there are times when outputs are in fact the outcome, and that is in terms of access, right? So if it's, oh, the increasing the number of people who have access to Medicaid, right? That's an output, but it is the change. People get on Medicaid, right? So when there's an issue of access, that number is also, that output is also an outcome. It's not, go ahead.
Good. I was just going to say, so also the thing about outputs and outcomes is you can also think for outputs, you can have 10 people go through your financial management program, right? And so your output is 10 people completed the financial management program. But your outcome is 10 people understand financial management and you have skills to manage their finances better, right? That's the outcome, is that exactly what you were saying, is the change in knowledge, change in skills. And the output is just how many people did it. But we all know that there's lots of things happening out there where people are going through the process. You can count how many people came out, but the question is, so what? And that's where you get to your outcomes, is so what? So what did they do? They went through this. So what? What happened because they went through that? That's your outcome. Does that help? Your so what gets you to from your output to your outcome.
That's always a good question. And yeah, that's always a good question. And
and there's lots of times, right, where we're doing we're reporting, and this is a whole nother, could be a whole 2-hour discussion about reporting to funders, especially if it's like a 1-year funding, where they want you to give outcomes when all you really can do is give outputs, right? And you hope, like with your pre and your post test, that you can show that there was change in knowledge, but you're going to be hard pressed to show that the folks are actually then implementing it. It's kind of like like a racial equity training, right? You can have 10 people go through a racial equity training, and at the end of that training, you can do a post test, right? You can do a pre-test and a post test, and people can say, yes, I understand concepts A, B, and C because I went through this training. They got the concepts. And maybe that's your short-term outcome, is that that change in knowledge is your short-term outcome. But what you want your long-term outcome to be is that they're actually using that change in knowledge to change their behavior, right? So there's your short-term and your long-term outcomes.
Yeah, that's what, Charlene, that's what I was thinking about, how, because that training and capacity building does not necessarily mean it translates because of a host of factors within a particular context in terms of people actually turning the corner to implement and change behavior. So that's why I was asking. Okay, that's helpful.
Yes, so that's really where there's long-term and short-term and long-term outcomes, But you see that the output is just that they went through the training. Then you have an outcome, and hopefully you're going to have some change in knowledge, unless they really were zoned out or, something didn't go well. But then your longer term outcome is, okay, how did that actually change their behavior? Right. Okay. Output is the process, how is the implementation, and outcome is the results. Okay. Process, how is the implementation?
Charlene, we've got 10 minutes, so I'm going to keep us moving here.
Okay, and I'm going to. Okay, keep us moving, going the other way. Okay.
There you go.
Great. Okay. Thank you, Jemima, for your information. Okay. So we need a couple of things before I go to the homework, and that is, if you did not register already with Melissa, can you make sure that we have your full name and email so we can get you with a partner? Okay. So Melissa you should be able to send Melissa a private message and just make sure that she has your full name and email if you haven't already registered for this through her. Okay, so here's your homework. On our secure website, there is a template. It's a Word document that you can download, and it's just a template, a blank logic model template. And what we would like you to do is fill that out. And you can do it as detailed as you want, or it can be less detailed, but it's really, the more detailed you get it, the more useful it will be for you. But we also recognize the limitations of your time and energy and other things you've got to do. What we want you to do, what would be great, is if you have an upcoming grant proposal that you're thinking about, and you're putting together a program or putting together funding for a program, how does that develop a grant, a logic model for that? Or if you have an existing program that you want to evaluate, and you really want to think more about how to capture the outcomes for an existing or a planned program. So what we want you to do is really look at what you're doing and how would creating a logic model be most useful for you in the work that you're already doing, right? So is there a program that you are wanting to improve and thinking about evaluating, or you just, it feels a little fuzzy and it would be helpful to have a little bit more clarity around it. So we talked about our evaluation buddies, and what we would like you to do is to share your logic model with your evaluation buddy by October 23rd, which is next week, right? I don't know. I don't even know what today is. Oh, it's by Friday. Sorry. Yes. Yes. Okay. So by Friday, if you can share it with your evaluation buddy, and then find some time to have a conversation, either by email or by phone, and talk through what you've done, and maybe talk about what are your questions, what did you learn from that, give each other feedback. What do you think of the other person's logic model, right? And then send it to us by the 26th. What did we decide, Stan? Are they sending it to us by email, or are they? Yes.
Yeah, I think that's probably the best.
Okay. So on, we'll make sure that you have our emails. It's on the syllabus that we have posted. We'll make sure that you can get it. It's on the website. So what we would like is for you to share that with us. We'll say 26th is next Monday, and the next training is the following Monday. And we would like to have some time to really read them and give you feedback on them, and really see where you are, and how we can help, and then put in base what we do on the next one based on what we see how you're doing with the logic models in your homework. Questions? Questions about the homework?
We'll be communicating. We'll be really communicating with you all in the next bit.
Yeah. Yeah. And as we said, we really want this to be as useful to you as we can make it. So if you're having, if you're doing it and you're having questions, you can put questions in your logic model for us. Really pay attention to what is coming easily and what you're struggling with, so that we can help with that. And I'll just give a shout out to Fiona is at admin@partnersforimpact.com. We'll send out her email. But if you're having technical problems getting onto our website, you can also email Fiona, and she can walk you through. She's our tech guru. Okay, we'll work out. So we'll work out your the buddies. You may just email the person. We'll work that out, Jemima. I see that your buddy is not in this group. Okay, we'll see. Stan, can you, while I take any questions, can you go and share the our website? Sure. So that people can see what we're talking about. Okay, questions in the, yeah, so. We'll work out the buddy thing. If there's people that were not here today, partnered with people who are, we'll work that out. Okay, here's our website. And if you go to resources and then down to JRE training, and then put in our password, which is case sensitive, Kaleidoscope 2020. And it comes up to this secure page here. Okay. So Stan, can you click on syllabus? Right. So on the syllabus, you can see the overall objectives and then what we covered today. It has your homework assignment. And it has a couple of other, wait, go back. Yeah, has a couple of other resources if you want to go more deeply into logic models. Stan has a series of short videos. Each one is like 5 to 10 minutes long, going through the logic model again. And then there's 2 other websites that are deep dives into logic models. And there's the dates. And then you can see what's coming up as well for the November 2nd and the November 19th. Is that November 16th? Okay. Good. Yeah. Now, if you go back, Stan, and we'll be adding to the resources and things as we go. Stan, can you go back now to our page? Where did it go?
It just went away.
Okay, and so going down there, you see under homework, you can see the template for the logic model is there on the homework. You can see the slides are already up. And when we get the recording, we will, for this, we'll link that too. Okay, we are at 3:59. But is everybody good? Questions? We will work out. We'll work out the buddies for anybody that got paired up with someone who isn't here. We'll figure that out. But most people should be good. And we'll be sending you an email and kind of following up with all of that. Any questions?
So with only 1 minute to go, well, we're at 4 o'clock, but we're going to do a quick checkout. What's your color now? Pop it in the chat. What's your color now?
Okay, yeah. I went from a bright, energetic, bright pink to kind of a light pink after 2 hours of training. Thank you all so much for being here. It was great having you. Thank you all for all of your participation. When we meet again in 2 weeks, we'll actually want to hear from you more about your experience. So when I say kind of really pay attention to how the process goes, so you can tell us. Send us questions. Send us feedback. If there was something you loved or something you hated, let us know. Can't promise to change it, but we will do our best. And otherwise, we'll see you in 2 weeks. Okay.
Thank you all.
Thanks, everybody.
Thanks. Bye.
Bye.
Thank you. Thank you so much.
Thank you. Bye.
Thank you.
Okay, I'm going to stop the recording.